Hello, my name is Dr. Rich Blake, and this is another video from Dr. Blake's Healing Soul. Today we're going to talk about ankle, both evaluation and taping for the lateral side of the ankle. The lateral side is the outside of the ankle, and the one that, when somebody sprains their ankle, typically gets injured. So when we look at the lateral side of the ankle here, we have the lateral malleolus, which comes up as a bone called the fibula, just below the knee, and the peroneal tendons attach into it. There's a peroneus longus and the peroneus brevis, and they come into the foot. They help protect the outside ankle, and we have videos on this blog about how to strengthen the peroneal tendons, how to strengthen your ankle. And the last video was on how to individually test the difference between the peroneus longus and the peroneus brevis. Today I want to talk also about the lateral ligaments in your ankle. They have to be assessed. You have the anterior talofibular ligament, which runs from the fibula to the talus, and you have the calcaneal fibular ligament that runs down from the fibula to the heel bone or the calcaneus, and those have to be evaluated when you're looking for reasons the person hurts out, or just looking for clues of why they sprain their ankle or why they feel unstable to the outside. So the anterior talofib ligament that runs through here, one is going to be painful to palpate if injured, and two, you're going to do a push-pull test or anterior draw test, where you grab the tibia, grab the heel, and you try to slide the heel forward across the joint, and that will show if there's any instability, because it will go further. You're always going to evaluate both sides to see a difference. The other side is not really a gold standard if it's had previous sprains to it, and some people are just ligament lax, so they have loose joints on all these tests. The other test is called the varus thrust, and that's for the calcaneofibular ligament, and that you grab the tibia, you grab the heel, and you invert across the joint, and you're looking for bigger gapping away or movement across that motion. So and then the third one that's done routinely is actually not an ankle test but a subtalar joint test. It's a medial lateral translation across to see if the symptoms were coming from below. Typically when you palpate the subtalar joint, it always hurts, so that's not a really good indicator. So you see if there's any instability in it. So you grab the heel bone, grab the tibia, and you slide back and forth. So you're sliding across this way. So one test, we're coming forward, the anterior drawer test. The other one we're varus, and this one we're sliding it back and forth. So we're looking for reasons for instability: weak muscles that we talked about, loose ligaments. There's another reason people hurt along the lateral side, and that's because they pronate too far. It's actually the opposite. Instead of supinating too far, where they stress everything out, they actually pronate too far, and they impinge either the subtalar joint or the lateral ankle they're going to get worse if you do things like ankle brace or the tape I'm going to show you for the outside. So it's a diagnostic clue, actually. People should feel better if you're treating the right thing. So the taping I'm going to use to stabilize the outside of the ankle is what is called Leuko tape. This is probably the strongest tape that I know out there. I know they have a sports version that's a little softer now, and that's spelled Leuko, and it's sold together with what is called coverall or cover roll. It's a white tape that sticks to the skin and actually protects the skin. The Leuko tape should never touch the skin. So to protect the outside of the ankle, we go underneath the inside ankle bone called the medial malleolus. We go around the foot and we come up the leg. And you want to spread out the force, so the higher the better. And patients will wonder, like, well, why are you taping that high? Because you're really just trying to have the force be spread over a bigger area. And so typically when I do it, I use just one. But when patients do it, I sort of encourage two of the white, and it's only one of the Leuko tape. So, and that's that reason, because it's so much easier to put on and protect the skin. So we take off a little bit of the tape and we put it underneath the medial ankle bone, and then we slowly pull it up. And this is so powerful. So if you have some ankle pain and you're going for a backpacking trip, boy, this could be really helpful for you. Or you just want to increase your walking or your workouts. So there's no tension on this one. I'm not trying to put the foot in any position. It's just a skin protector. So you sort of peel it out so it's as wide as possible. And so it has this, what we call J shape to it. And then I'm going to do a second one a little bit further, just so I can put the Leuko tape in the middle of it. So it's going to overlap, each one's going to overlap by a little bit, by maybe halfway. So again, the second one comes on, and this stuff really likes to stick, so this is an easier way where you peel off just a little bit of it and stick it on. It still likes to stick a lot. And again, so we're pulling it and making sure it doesn't stick too much. And it's over, you can see here it's overlapped by about halfway or so. And it just gives us a bigger target to put the Leuko tape on. So I've created this J strap with the coverall, and then I take the Leuko tape, and now this, since we're going to do this and try to stop inversion, I have the patient then evert a little bit when they put the Leuko tape on. Not too much, just a little bit. And then with the two, I have ample amount of Leuko, protection of the skin. The part on the inside and under the heel has really no tension on it. So I'm just anchoring the tape as I go around. When I come to the outside, now Leuko tape it has one tension. So it's not like kinesio tape or rock tape or dynamic tape that you have to pull it 50%, 70%, 90%. This one, you pull one way. It's just 100%. So you slide it on, and you've got the foot a little everted when you do it. I don't mind cutting this with my fingers, but I'll show it. Most people don't know how to do that, so that they have to use scissors, which is fine. So we put the Leuko tape on. It's nowhere near the edge of the skin, so it should be really protective. If Pat, I can have the camera here, so we'll just show you briefly sort of how it is on the foot. So you can see it starts under the ankle bone on the inside, comes around and goes up the leg. So this is a really good protector for the outside ankle. It can help me while I'm rehabbing a patient, getting them out of a cast earlier. It can help me with my orthotic care to brace up the outside of their foot for my bad supinators. And it's really, a lot of people love it when they're going to go on long trips, long hikes and stuff, you know, over like 2 or 3 days, and they want that extra protection for the uneven trail. So thank you very much, and I hope this was very helpful.